we are here today for part 2. We did the part 1 video to show you. Today the day we are doing the actual excision of the scar. So we'll do the marking. Marking is the whole game. You know, cutting and suturing, honestly, for plastic surgeons, this piece of cake is not a big deal. Main thing is just making the incision at the right spot in the right direction. That is the key. So I want to show how I do it. Not that I am the champion. There are many plastic surgeons better than me, but I just want to share my own technique and learn from others as well at the same time. So I'm going to videotape while I'm doing it, and as I always say, I make the patient a part of the team and decision making as to where the incision needs to go. Trust me, the patient has done this procedure in their mind 1,000 times. I've only done it 1 or 2 today, so he knows exactly where he wants, so I'm going to share it with him when we do it. So the first thing I'm going to do is I'm just going to mark the nasolabial line. It's very well defined. There you go. So now I know the direction, and then I'm going to define the boundary of the scar, you know, these scars right there. So now we know this is the problem area. Now we have to try to blend it in a way with the scar parallel to this. So I'm going to do very gentle. I'm just going to do little dots to try to parallel this right there. This direction, this direction. Not the final one, and I'll tell you why. Now I'm going to have the patient smile. Let's go ahead and smile. So you see, when you smile, it almost looks like a weird thing, because now this was straight, but this has to be a little curved. So now the long axis should be, instead of this, a little more like this. Little curve, right? Okay, so now this is going to be perfect, because what we are going to do is make an ellipse. There we go. Minimizing the excision. You don't need to take extra. Yeah, this is not for sale, so don't keep taking extra. Minimize it, minimize it. So I'm just touching the boundary of those 2 scars. There we go. Because even this, you know, when you put it together, it becomes longer. That's just the principle. Look at the ellipse. This is the ellipse. Oops, close it, longer. So it becomes a long scar. So just only what you need. But now you can see the direction. Right here, I'm going to almost make it. Now I can go to the bigger side, because now I know exactly where to go. So there we go. Right there. So I'm going to stop right there. Perfect. So now what I'm going to do is show it to the patient to make sure he agrees. If not, we'll remark it as many times as we need to.